kind of our mindset, right? That we put doctors on a higher pedestal. Like we feel like if they can heal, it's like they are like God or something. So it's
No, so that perception is actually not only wrong, it's dangerous. And you see that a lot of people get violent when things go wrong. And the real problem is that people need to be communicated with properly. Don't set the expectations too low or too high. Just be honest and transparent. The vast majority of doctors in India actually think that they're very good communicators, but they're not. And the reason for that is they are time poor. They don't have the time to sit down with the patient and really explain him the pros and cons, make sure that he's understood it, get it validated, give him time to actually assimilate the facts. They're much more about rote. Consent, just sign here and we'll do. And I've mentioned all the risk on the piece of paper. That you're writing those words in Latin. This patient can't even barely read Marathi. And you're saying hemorrhage. What the heck, yeah?
yeah. In fact, it's a joke these days, right? If you can't read the handwriting, that person is probably a doctor. So, yeah.
So the challenge of communication
Yeah.
actually needs to be tackled by giving the tools to the doctor whereby he can. There is no doctor who doesn't want to do this. It is just that he doesn't have the time.
Yeah.
Axon Care is this platform that he can do his job a lot better, a lot more effectively, a lot more productively.
Right.
The whole idea here is you do your job better, then I don't care how much money you make. And obviously, you'll make a ton load of money because you're very good at it.
Right, yeah, exactly. That's what I was coming towards. Like, because, like you said, the data will be already there, present in front of the doctor. So he doesn't have to ask like hundreds of questions to understand what exactly is happening with the patient sitting in front of him. So basically, it's time is saved in that side, so the doctor can actually properly communicate and assure the patient that okay, we are going to figure it out and everything is going to be okay. So yeah, that's amazing. Coming to the next question, sir. How is Exonic envision contributing to the broader healthcare landscape in the coming years?
Absolutely. First of all, I'll tell you, we are not separate from existing healthcare at all. Axon Care is what a platform. It's just a way in which we augment and support what doctors and hospitals do today. We are not here to replace anyone. I'll tell you, the whole concept is not about replacing anyone. But if this is about empowering the doctors, empowering the hospitals, and we all have massive challenges in the hospital sector. And the reason those challenges exist is because no one actually took time to look at the problem from a holistic perspective and create a solution for it. Everyone merely created a process and expected it to be the most efficient process. It didn't work. I'll give you a very simple example to prove this. Now, even today, there is a big practice where people are admitted the day before surgery. And they say, "Ki, nahi, nahi, ma'am, we are going to operate very early in the morning, so we are going to admit the patient overnight. So we can do a pre-operative check whereby the physician can wander at some time of the evening and he gives you an all clear." I believe it's the most flawed model, which is not only useless but expensive. A physician visiting a patient a night before surgery is never the right person to assess his risk. The risk assessment should have been done at the time of taking the decision to operate. Because let's assume, even if I flag the risk, what are you going to do? You're going to discharge the patient and reschedule it, which means that a lot of money got spent unnecessarily,
Right,
right?
right, right.
Second, what the physician going to do? Ideally, you should have an anesthetist who's actually checking the patient. The physician is not going to really do anything. He's just going to say, okay, everything looks okay, fine. Anything goes wrong, he's going to put his hands up and he says, in my opinion, it was fine.
Yeah.
So these kind of practices will stop once they have the right help at the right time. So when I'm operating on someone, let's assume you come to me, you have tummy pain, and I feel you're going to need surgery. At that immediate point, I can say, hey, listen, you know what? I'm going to ask my anesthetist to just have a chat with you, and he will ask you a few questions just to make sure whether surgery is a safe option for you or not.
Right.
Now, what it effectively means, my anesthetist is looking at the same data that I've looked at.
Hmm.
He's going to say, yeah, now I know you've got hypertension that is well controlled for the last 12 years, but your ECG is showing some epics.
Right.
So have you had an MI or whatever it is? So the risk control part will happen well in advance.
Right.
You're not leaving it to 1 hour before surgery. So there are a lot of little things. I can assure you, there's just one of maybe thousands of examples where we have been doing it the same way for years without thinking.
Right.
We've just never sat down and thought, is there a better way of controlling this risk? And that is because I majority of the doctors, I'll tell you, ask any, I shouldn't say arrogant, but surgeons, what is your complication rate? And I'll tell you, everyone will say, I don't have any. Because they're so egotistic, they pretend that they never get into trouble. The reality is about a million miles away from it.
Right.
But they make it because they don't have access to the right tools. I can make them completely complication safe. I'm not going to say zero, but I will say low. But in order to do that, they have to rethink their risk and apply the right patches.
Yeah. It's all about basically the information that we are getting out of it, and yeah, the risk factors and everything is lessened. So yeah. And about your comment about surgeons arrogance, I think I have another thought about it, that I think for being a doctor, you have to have that kind of confidence in your skills, right? Like another person's life depends on you. So if you are not that confident, everything can go
Now,
sideways.
let me put it this way: as a surgeon myself, after 35 years, the confidence is not a problem. Any senior surgeon will tell you, yes, there is always a complication rate. Yes, we minimize our complication rate. The arrogance is usually when you're very early in your career, and the reason you're arrogant is because you're scared. You're not arrogant because you want to be arrogant. You're arrogant because you think that in case if I say that my last patient had a bad outcome, this patient will run away. So you are actually thinking from the perspective of business rather than the reality. And those both these approaches are wrong. I don't want anyone to get into complications. How do I stop complications? It comes to understanding how risk happens. And this is when Axon Care, when you look at what Axon Care is, you realize that everything has been taken care of.
Yeah,
What
exactly.
a doctor, we know what you can do, but we also know what you can't do.
Exactly. So basically, the fear and everything is taken out.
Absolutely.
So you can focus on what you need to do.
I'll give you a very simple thing that I just remembered, again, very early in my career. I had operated on someone, and 3 days later, the wound just burst open. We call it as a abdominal wound dehiscence. And I was very unhappy, and I thought, you know what? I didn't stitch properly or didn't I tie my knots properly. I was very guilty. In a way, I was feeling very let down. कि यार, इसका तो wound खुल गया. After 3 days, obviously I did all the right things. We took him back to theater, did secondary suturing, all that. But when the patient was recovering after the second attempt, I sat down with him and said, "What, I'm very sorry this happened." But he didn't say anything, and my attention went to his pill box next to his table, and I saw a box with prednisolone steroid tablets, and I said, "Hey, do you take these tablets?" He said, "Yeah, I take two every day." And how long have you been taking it? I've taken it for months. मेरे गांव के डॉक्टर ने बोला ये अस्थमा के लिए बहुत अच्छा है. And he had not told that to anyone. In his preoperative assessment, we did not know that he was on steroids. And I'll tell you the reason my wound opened up was because he was consuming steroids when he shouldn't have been.
Oh my God.
So there are a lot of learning experiences where we say, "Okay, listen, data is not always available the right way. You have to give people time and you have to frame your questions in their language.
Yeah.
Don't ask him what medications are you on because he was thinking कि अस्थमा का दवा is not दवा. ये तो मेरे को डॉक्टर ने बोला इससे अस्थमा होगा नहीं. ये दवा थोड़ी है.
Yeah. Yeah. ये तो नुस्खा है.
These are little things, but they matter a lot.
Definitely, definitely. And I think, especially in country like India, where everybody has that nuska ki, "Arey, okay, you got cold, take dalchini wala chai. You have this, do that, you do that." And this not only stops at home remedies, it turns into medicine, and people don't always realize that they have to tell everything to the doctor. So yeah, that is, I think, fairly common thing that happens, I guess, that I should have told about this medicine, but I didn't, because I didn't think it was needed. So yeah.
No, people forget and people don't remember Latin names. It's very, very common for me to have a patient who tells me, Doctor, I take some blood pressure pills, I don't remember the name. But no, don't remember the name means that now I don't know what he's taking.
Yeah, and it's such an important medicine in a way, right? So yeah. Okay. This topic is, I think, going on and on. So coming to our last question, sir. I think we have kind of covered it, but I would like you to tell us anyways. What unique features or services does Exon Care Clinic offer, compared to the whatever is available right now in the market?
Either the answer is nothing or everything. And I'll tell you what I mean by that. Do I change your care process? Not at all. Do I repackage and do your care with exactly the same steps but done it in a different way? The answer is absolutely yes. So the idea is, as a patient in Axon Care, you will have probably a very good experience because our entire model is built around a patient. It's a patient-centric healthcare. It is not a doctor-centric healthcare. It is a doctor-patient empowered healthcare model. So when you look at the individual components, absolutely we are no different than anyone else. When you look at how our process is, we are completely different than anyone else. So that's what I would say in summary. But Axon Care, the last statement I'll make about it is Axon Care is an experience that you need to take if you need it rather than read or listen to it, listen about it.
Right, right. Yes, definitely. And to be honest, I'm very excited for the upcoming clinic launch. And yeah, I'm looking forward to it, because as much as I know about it, I'm very interested to know how people will react to it and how it's going to be, because it is going to be a game changer and kind of a new healthcare revolution. So yeah, that's really great. Um, okay, so we have come to our closing end. Thank you so much for sharing the whole journey and all the experiences with us, sir. This was very interesting and truly amazing. Yeah. So, to our listeners, like, comment, share, and subscribe for more such content. Until then, stay safe, be informed, because your health is in your hand. Thank you.
Thank you.